Hello, and welcome back to another episode in our special series on cancer care during the COVID-19 crisis. The pandemic continues to present new challenges to oncology care delivery. ACCC is here to give you quick tools you can use right now. Today, COVID-19's impact on access to oral oncolytics and what we can do for patients. With us today is Dr. Lauren Sanders, an oncology clinical pharmacist at the University of Arizona Cancer Center.
There may be some cases where you may even consider using an oral antineoplastic therapy rather than an IV treatment modality, because there's that convenience factor here, right? Because that oral specialty medication could be shipped to the patient's home. It does not require administration at the clinic like an IV therapy would, but it does still require that vigilance in patient education, adherence checks, close monitoring, and toxicity management. Other than protecting our patients, we also want to make sure that we're protecting our healthcare workers too, because they're really on the front lines every day. So across the country, I think we've seen that the healthcare community has really adapted to function with thinner staffing models. For those who can or who are under home quarantine with capability, even in our practice, they're encouraged to work remotely. So some staffing models may divide teams, and half the personnel works physically in the clinic for 2 weeks, and the other half are working remotely in their homes. So the number of physically present workers is a lot skinnier here to keep our clinics up and running no matter what. But this does also pose some issues. We need to be cognizant that with these skinnier staffing models, there's also potential for access backlogs. So that can lead to delays in access in some cases.
Are you finding any potential access issues for patients because of remote workers and thinner staffs?
I think it does start to provide a delay in our ability to access things. Prior authorizations sometimes require multiple levels of appeal. There's a lot of time involvement for this, and having fewer staff and working from home, perhaps without access to a secure fax, these perhaps do become harder. So overall, a delay in access to approval and receipt of a medication can be a delay. We do want to continue to find solutions to mitigate this.
Are there any other solutions like waiving prior authorizations that we can adjust to during this time?
That's definitely one of the solutions that has been proposed. The Community Oncology Alliance has put forth a letter to the Trump administration requesting that we do waive private health insurance prior authorization requirements during this time period. And that is one solution that could potentially help mitigate that problem with access.
What about services like virtual education and adherence checks during this time? Can you talk about how important those are to utilize?
Absolutely. So in the coming weeks, it really is important for people to stay home when possible to reduce risk and spread of infection. And for our cancer patients, this is especially important. So as we continue to evolve our daily practice to keep our patients and providers safe, we have at our availability these innovative tools like telehealth. So we're able to reach our patients by phone call or with a full video interface for virtual clinic visits. And our oncology patients can connect with the integrated healthcare team to receive care safely in the comfort of their own home. And this is such a terrific opportunity, I think, to expand these services, things like telehealth and digital medicine, because we're actually able to increase access to care, prevent the possible spread of COVID-19, and continue to utilize our virtual workforce really effectively.
Have you seen patients been making more requests for 90-day supplies of their medications? And does that create any safety or supply concerns?
That is something that I have noticed in our clinical practice. There is a concern from some patients about the supply chain of their oral oncolytics, especially as China is known to be one of the largest producers worldwide for pharmaceutical ingredients.
Mm-hmm.
So the request for larger supplies and medication at home has been something we have noticed. However, this can kind of backlog workflow in attempting more insurance overrides or new prior authorizations to obtain these larger supplies. And at this point in time, there have not actually been any backlogs of the supply chain, and that's something that's been well monitored. it is just really great to see how our healthcare teams are coming together across the country and pulling together all these viable actions with technology like telehealth to really keep protecting our patients and our healthcare workers. And, I think we'll continue to innovate and drive the practice of medicine into the future in this way.
Coronavirus is testing the medical supply chain in every aspect. ACCC will keep track of the latest developments and help you continue taking care of patients and delivering quality care. Find more information and resources in the show notes. Until next week, for the Cancer Buzz team, this is Summer Johnson. Stay well.